My name is Owens Matengu, moderator of the SPYL Public panel discussions on health matters. I hope we are all keeping safe by sanitizing our hands, wearing our face masks, and observing the right social distancing. Now, tonight's panel discussion is themed post-COVID-19 impact, medically, economically, as well as socially. As usual, I'm not alone in studio. I'm always joined by two comrade medical doctors. Dr. Stanley Kanyemba. Good evening, Doc, and thank you for joining us.
Good evening, comrade moderator. Thank you. It's always a pleasure being here.
Comrade Dr. Nelson, good evening, and thank you for joining us.
Good evening, comrade, and good evening to our viewers, and it's a pleasure to be with you again in the studio.
Now, to put our panel discussion into perspective, Namibia launched the COVID-19 vaccines in April 2021, hoping to vaccinate about 10,000 Namibians on a daily basis and 1.4 million Namibians by March 2022. However, to date, as we speak, 19 August 2021, only 190,000 Namibians have taken their first dose of the vaccines, and about 80,000 Namibians have taken their second jab of the vaccines, which would say have then completed their doses. So the 80,000 in comparison to our population is currently 3% of the Namibian population is what has been inoculated as we speak. It is for this reason that the SPYL Party Youth League leadership then took a decisive decision to say we need to champion the COVID-19 vaccine campaign side by side with the Ministry of Health, because we are then the transmitting belt of the SPYL-led government. And we hope through these panel discussions to provide about or achieve about two things. Number one will be to educate the public on what is the importance of these vaccines. Now, scientific research out there shows that the vaccines provide the much needed immunity in the event whereby one is exposed to the virus or one gets infected. You have mild to less symptoms and you will not be that critical sick. And the chances of one losing their lives when they are vaccinated are very rare, as opposed to when you are not vaccinated. And the second thing we hope to achieve is to educate the people so that we reach our much needed herd immunity of 1.4 million. So the current government estimation is that we are going to reach that target by March 2022. But if we go out in numbers, get vaccinated, the sooner we reach our herd immunity, the sooner the country would open up, then we are going to restore the economy to its normality, because currently the economy has bled millions of dollars through these trade restrictions and all these lockdowns. And thousands of jobs have been lost. So once the country reaches the herd immunity, we are going to restore the economy to its normality. The much needed jobs that have been shed will be restored. I think with that having been said, let me give now to the medical doctors. So, comrade doctors, post-COVID-19 impact medically. Has been 1 year, 5 months since the first 2 cases were recorded in Namibia. So how has the experience been like treating the patients with COVID-19? Comrade Stanley.
I think you laid the platform for the discussion. And I think pre-COVID, during COVID and post-COVID, there is a theme with this disease, and it has impacted almost every aspect of our lives. I think to start off with, you mentioned about herd immunity and our challenges in reaching the numbers. I think that's where the theme of post-COVID also comes in, and the discussions we need to have to say, what are the challenges we are having with our population accepting vaccines? What are the social challenges? What are the economic challenges? What are the challenges in terms of acceptance of these vaccines? So that will be the introduction or the theme to which I will go. And we hope to make this a lively discussion in terms of that.
Yeah, indeed, as Comrade Stanley has alluded to earlier, it has been a very challenging road. particularly not only for the entire nation and the community at large, but also for healthcare professionals. Of course, navigating through the storm has not been easy. Many lives have been lost, including healthcare professionals. And really, the message you're trying to drive, out there and to inform, society at large is to say that, if we then come to a place of acceptance and taking responsibility and doing the right thing, we will be able to steer our nation in the right direction and restore normality at an earliest that we can. The idea really is to, create an awareness where we are able to reach our people at a level where they can accept and understand that the vaccines are produced and they are designed in the best interest of humanity. Contrary to popular belief that people think maybe there has been an agenda behind this. And of course, we can't also entirely speak post-COVID until we have reached our herd immunity. So unless we reach our herd immunity, we probably are still in a bubble as a nation, and anything can come up.
And on that note, also to say, to expand on the vaccines, we are welcoming the Russian-made vaccine on the scene, and we are appreciating the efforts made by government to produce variety of choices for our people. There is also a call towards the Pfizer vaccine. We hope that this will also be made available through the efforts with Germany, and it's at that point that one wants to look at the different aspects of society that's impacted by COVID. I think it would have also been nice at this point to involve an economist to sort of direct us in terms of the economy. But basically, when you look at it, what COVID has done and then the industries it has affected, largely Namibia is having a big tourism industry that's producing much needed foreign income to our country. Now, if you look at the impact this has had on the tourism industry and everyone else that's dependent on the tourism industry, and then you look at what will be needed to bounce back from this industry in terms of bouncing back post-COVID, and tourism industry is probably ideal to discuss in terms of the gains that have been made to make our country popular. Now, those gains that have been made in terms of travel and welcoming foreign guests, can you imagine we have been taken back a few years? And I think that's the theme with COVID. Every gain that has been made in terms of advancing the economy has been lost. And because of that, if you look at the tax income for government, how much was contributed to the GDP. Now that tax income that was coming from tourism pays for your education, it pays for your health, and it pays for all your benefit funds that society depends on. It must also pay for infrastructure, the housing infrastructure that we are seeing, that's a common problem now. So that's the sort of thing that we should look at. And what do we need to do, therefore, to sort of revitalize this industry post-COVID? So that's the interesting aspect for me. Perhaps also, therefore, it goes without saying that the vaccine acceptance must be driven. The vaccine acceptance must be driven because it will allow us to accept and rebuild most of this industry that depend on the interplay between the different aspects of society. Therefore, I want to touch especially the education sector. If you can look at the education sector, it has really been taken on its feet. You look at primary school education, secondary school education, and university education. You looked at the need for especially when it came to university, there was certainly a need for virtual learning. Now you must appreciate that the majority of our population actually comes from the not so well-to-do aspects of our society. Now, post-COVID, what are the lessons that you learned that these aspects of society need to be prepared in case there is a similar pandemic in terms of education that will be needed? And the efforts that NASFAF has made, Ministry of Higher Education has made in terms of providing laptops for some of these learners. Perhaps also post-COVID, that aspect, one wants to look at it in terms of integrating it into our society to say, look, some of these gains that have been made, how can we make internet connection cheaper? We cannot say post-COVID that there's certain well-to-do aspects of our society and the non-well-to-do aspect of our society should be treated in terms of internet access the similar way. We have to relook at the packages. We have to relook and say, is internet really a right, or is internet a luxury? Can internet actually also, because if higher education is a passion of mine, if you are looking at how much it takes for you just to get to UNAM, I was also at UNAM at some point, and living at Ongorangava, I had to wake up very early, 6 o'clock in the morning, to catch the UNAM bus. Often, most of our not well-to-do society, you have to catch a taxi from Katutura to KLC and from there to UNAM. Now, perhaps for that aspect of our society post-COVID, we can say that distance education and face-to-face education, I don't know why we are still separating it as two different points of education. If my lecturer can be live and I can sit at home, I have a cheaper internet rate, I don't have to climb taxi. Maybe I can use that money to buy food. I think in terms of pushing society forward and the gains that we have to make, those are the type of things that perhaps post-COVID we should be discussing. Let me end at that point and allow Dr. Makemba also to come in.
Yeah. Another aspect that we really have to look at, for instance, navigating the ships going forward. Of course, at the height of this wave, we realize that even in our medical fraternity, both hospital facility, particularly both private and state, had at some stage reached their maximum capacity. We had people getting more sicker. There were no facilities available to accommodate our people. Perhaps also this is the time now that the SWAPO-led government and the line ministry, which is the Ministry of Health and Social Services, look at aspects of developing more facilities. As it stands right now, we have the major facilities that serve the masses of our people is Katutura State Hospital and Windhoek Central Hospital. And this has been the facility that we have had in the city for a very longest time. And they are also dilapidated in a way. So we really need to look at aspect of availing resources, establishing more facility, so that we are well equipped, and able to serve our community properly. We also need to look at aspect of the inequality. COVID has really demonstrated how unequal our society is. To say that, for instance, if you have medical insurance, in this time you probably stood a better chance because you could afford, a more private facility that gives you access to better care. Of course, better care also is delivered in our state facility, but then the pressure was rather too much. Our healthcare professionals, most of them were also not able to cope anymore, because in as much as they wanted to give the best they can to their people, sometimes they were limited in terms of access to facilities, access to what is needed to deliver a proper, healthcare for our people, access to proper, ICU facilities. So this is really the time that we need to have an introspection, sit down, both professionals, and leaders in us to say, look, what is it needed to make healthcare work for our people? And also looking at aspect of human resource and human development is also a time that I think we need to encourage more of our young people that want to pursue specialized field, avail funds, have them go out there, learn their skills, bring their skills back home, and then we will have, equal access, to skills that are really needed in order, to help our people. That's also something, that stand out for me. And, the social dynamics, like Dr. Kanyemba was alluding to, especially aspect of, people that are not in a well-to-do brackets. I think, especially, with the Ministry of Education, I think we have to consider redesigning our curriculums to say, look, maybe subjects that don't require practical, human hands-on experience. Is it not maybe about time we consider, having our students then having those lessons done on, internet platforms? And then maybe for the classes that need practical lab experience, then they make, travels to the institutions. And in that way, we can cut costs. But then we then have to address the aspect of, access to internet services. Is it a luxury or is it a right, especially in the 21st century, And what is our SPYL government prepared to do to, meet our, disadvantaged community, especially in accessing such, services?
Yeah.
Comrade doctors, you alluded to the fact that the hospitals were full, had run out of capacity. But scientific research shows out there that this is not the first pandemic we have faced as the world. This is the sixth pandemic that we have faced.
Yes.
So, for one to say maybe we were caught off guard or we were less prepared as humanity, so why couldn't we do more research? Because this is not even the first time we have had this pandemic. So, why wasn't there more research done? Because this is the sixth time that we have been faced with a pandemic, and for us now to say we had run out of hospital, one would have said no, but we're too much complacent. We should have done more research and to be better prepared.
Namibia is a member of the United Nations, and I love the role the United Nations has played in the history of Namibia. Now, when you look at the United Nations, they came up with what's called the Sustainable Development Goals. Sustainable Development Goals are a very ambitious aspect where the world came together and they had decided that we have to make the world a more equitable place. It's interesting that the Sustainable Development Goals, I think they came up with them in 2015. From 2015 until 2030, they replaced the Millennium Development Goals. Now, when you look at the Sustainable Development Goals, there's 17 of them. Now, in these 17 goals, the world is trying to address those aspects of society that will take us forward. What do I mean? When we look at Sustainable Development Goal 3, that deals with human health and well-being, this goes into what Dr. Makemba was saying in terms of how much we need to develop. Now, under Sustainable Development Goal 3, it was expanded further to universal healthcare. Now, when you talk about universal healthcare, and you come back to Namibia, 30 years later, we still have a private system and a public system. This is an eyesore. This is a harassment to our society. How we have a private sector and a public sector. It shows that we have not moved 30 years later on a lot of these aspects. What am I saying? I am saying that what COVID-19 showed us that even if you have a medical aid, when private healthcare facilities were full, you ended up at Karutura Hospital. What does it tell you? It tells you that there are some resources of a society that cannot be exclusive. What am I saying? Therefore, it goes without saying that you cannot have exclusive funding. What am I saying? I am therefore going and saying we need to look at a universal healthcare system without calling it any particular name, because I am saying that there are certain facilities that need to be shared by the nation, not based on how much monetary income you have as a family, but to say that we all need access to these facilities. Therefore, we need to redefine how we fund those facilities. You cannot say that 70% of health funding goes into private facilities. However, when you are hit with a health calamity, suddenly this funding cannot respond. Where is this funding there for sitting? Because it's needed now. Suddenly you are going around buying oxygen concentrator, Ramatex, you see. However, you do not discuss your healthcare system to say private for who, public for who. This is what we have to discuss post-COVID when it becomes to healthcare system. We have signed the Declaration of the United Nations, I think it was 618 if I remember correctly, that says that health and well-being must be provided for all by 2030. 2030 is 10 years from now. Post-COVID, we need those discussions. When you look at sustainable development goal, you have to discuss healthcare infrastructure, funding, and human resources. What am I saying? You cannot have a pulmonologist just for a certain group of society. I'm sick, there's a pulmonologist sitting next to me. What about I'm sick there in Ongurengava, there's no pulmonologist coming to me? Why not? Why not? That's the direction that we should push. And these are serious discussions because we can no longer have these two dichotomous health funding sectors. We cannot have. We cannot have because it doesn't serve society. COVID-19 showed us that. One more reminder. Now suddenly private sector is coming. So when Dr. Makemba is blaming, it's not a government issue. Where is the private sector? Why now suddenly there's 14 million coming from X company? Where was it from the beginning? You didn't know that we only have 2 healthcare facilities? Where were you? Where is your social responsibility funding going? These are the discussions post-COVID. We cannot run around looking for concentrators, concentrator here, concentrator there. 2.4 million population. Everyone should have their own ventilator. Must be everyone own ICU. It mustn't even be a discussion. That's where we should push. Let me allow Dr. Makemba to come in.
Another aspect also that we need to look at post-COVID, especially from the medical fraternity, we need to look at looking at the laws that will safeguard the industry. What do I mean by that? You cannot have a system where I, Dr. Makemba, have acquired the skills that is needed by the masses of our people. But because I only prefer to set up and work in a particular facility, I then tells you, look, I am not interested in seeing patient in A, B, C facility. So we need to create a system in a law that says, look, you have the skills, they are needed by our people. Now, if you are prepared to be part of society, work in society, it is okay. If you prefer to set up a facility here and work here, it's fine. But we are asking you to say, for the next 5 years, we want you to share those skills also with the less privileged. We cannot have a system that will now register doctor with the Health Professions Council that have the skills that are needed by the majority of the people, but these people are registered with the council and they are not prepared to share the skills with the masses of the people. So council need to come up with a law and say, we are only going to register you and allow you to practice in Namibia if at least minimum for the first 5 years, you are going to be sharing your skills with the less privileged, meaning that even if you now set up office privately, at least every morning dedicate your first 3, 4, 5, 6 hours to the matters of our people. But if I come to you and say, Matengu, I want to set up office in Windhoek, but I'm not interested in the Katutura population, and you register me, you are going to create inequality because I have the skills, but it's not benefiting the masses. I'm only catering for the few. And now you find the private sector is catering for less than 30% of the population and is highly packed with skills that are needed by the public sector. But some of these skills are not shared in the public sector because individuals are not prepared to work in the public sector. That is going to create inequality and is going to hurt our people, is going to hurt our society.
Just to add on what Dr. Makemba is saying to understand is, it brings about a point that certain things cannot be privatized to an extent that they are exclusive. Exclusivity breeds unhappiness. People feel left out. There's a leader that talks about people feeling left out. And somehow sensitively, we need to navigate these challenges to say, society can no longer be exclusive. Because when you breed exclusivity, you are saying, and people are always talking about the funding. When we look at the funding pool that feeds this exclusivity, you realize that the majority of companies funding are parastatals. Majority of companies funding are the very same companies that were funding 14 million here in crisis time. You need to look at this funding that we are directing. Can we have a discussion that we can throw things open? Obviously, we will not be comfortable, but the concentrators that we are running around showed that it's an unsustainable thing that we are doing. It's unfortunate that the right to health is not guaranteed directly in our constitution, which is we are proud of our constitution, but there is no right to health. Two-thirds majority is needed, Comrade Youth League, to re-put those things in. Because look, how do we socialize certain aspects of human need without the fear that the exclusivity will be lost? I think that's what Dr. Makemba is saying. You cannot qualify as a plastic surgeon, but you are only plastic surgeoning a certain minority of the population. It cannot be. If we discuss money, I don't think money is the issue. It's the way we distribute our things. We can pay you to come and sit in the
and serve our people.
Serve our people. We can pay you. We can. The types of resources that came through from the private sector during COVID. Hopefully, we can discuss those resources during peace times. I call COVID war times. Peace times, we need to discuss to say. I actually call for a national health fund post-COVID, because this discussion we need to have. We need to have a discussion of national health fund that will move into some kind of a national health insurance. Whether Matengu works for Namibia Breweries or Matengu is unemployed, we don't care. Matengu needs to be insured so that when Matengu is sick, he can access healthcare. That can only happen if we're having a national health insurance. Social Security Commission in their acts mention national health insurance, but they fall short of implementation. So that's the challenge to the Youth League. There is a lot of things mentioned in a lot of our documents, but are the youth reading these documents to say, this is what you had said, comrades, at the election. Why is this section not implemented? Because our people need it. Now, during COVID, you are running around. There's another, sorry, I don't want to monopolize the discussion, but COVID is also showing how, processes, systems, institutions, we learn it from our leaders, processes, systems, institutions. We need to build institutions that will look after us. How do we build these institutions? COVID-19 is an international disease. Comrade Matengu, our airport, is there a screening facility for diseases that are coming in?
Not sure.
I leave it to you. To discuss.
Okay, Comrade Doctor, you mentioned about universal healthcare system. So how do we go about then ensuring that we achieve this? Because it's high time we need to walk the talk.
Yes, that's Comrade Matengo. I appreciate the fact that you bring up the question, and this is actually, the reason for these kind of discussions, because there's no point in us talking without implementing. Like I said, for instance, if you do study health systems and laws that rules and govern health systems in different parts of the world. Let me just, for instance, use South Africa, which is just nearby, as an example. They have a very meticulous system that makes sure that, at least, those that have the skills are serving the masses of the people. I don't think those laws are implemented in our society. I have made an example earlier to say, me as Dr. Makemba, for instance, I do decide to go and pursue a specialized field. I get the qualification, I have the skills. But now upon return into the country, having acquired those skills and having certified as a qualified specialist in that interest, I come back and I get registered with a body that govern, those that practice medicine. But then me as an individual, I am not ready to share my skills with everybody. Therefore, I am only going to treat the private patients with medical insurance. So what that then tends to happen is that I rob the rest of the country the skills that will benefit them. So what am I saying? If the SPYL government, and the institutions that are responsible for this are going to look at aspect of changing the laws a little bit to say, guys, if you are coming back, we need you to render services to the masses of our people. Registering you with the body and giving you, the tool to say you are ready to practice medicine in Namibia is not a problem. But at least also share your skills with the people that need you the most. You can't just have a situation and then I set up a private room. I've never seen the inside of Katutura Hospital. I've been here 20 years. That is very unfair. But you have specialized skills. But the majority of the people that actually need your skills are sitting at Katutura Hospital. But you are ready to be part of the Namibian society. But that is unfair. So this is where we need to know the laws that govern how medicine is practiced in our country. And we say, look, if you're not interested in rendering services where it needed the most, unfortunately, maybe you can find another destination. It is fair to do it that way.
Yeah. And Comrade Moderator, to further explain, when you look at the world, there are about 240 countries in the world, roundabout countries that have health systems. Only about 40 countries have specific health systems. When you look at specific health systems, there's about 4 of them. There's what's called the RACE system, National Health Insurance System, and out-of-pocket system. Why are these systems important? These systems have, and you looked at these different systems. The Beveridge system is named after William Beveridge,